Hi, I'm Dr. Sebastian Gonzalez, and today the topic is shoulder impingement or just shoulder pain. So impingement syndrome, commonly it is when someone comes in and they start raising their arm to about here, and 90 degrees abduction, you're going to feel a pinching pain on the front of the shoulder. This is impingement syndrome. A lot of times you will have a correlated pain or burning down to the arm. That's very common. Now let's look at the shoulder model to show you more of why you're having that pinching pain. I want to scoot closer to the camera here just so you can see. This is we're looking from the back of the shoulder right now. Humerus right here. We're going to raise the arm into 90 degrees abduction. Now you start to see that pinching, the contact between the acromion process and the humerus. So acromion process, greater tuberosity of the humerus, they're pinching right there. Now let's think about the structures that pass beneath there. So there's the supraspinatus muscle, has to have its tendon go underneath it, as well as the biceps tendon will go underneath it this way, and a bursa. So a lot of times these structures will get pinched on when the space is not preserved between these two osseous structures. So the shoulder pain in itself is one thing very irritating to a lot of people. They can't do their sports. But you know, the real things that I'm interested in, and I see a lot, are the complications that come as a result of having a chronic shoulder injury. So let's think about there's an athlete or just a homemaker at home reaching up for something off a high shelf, or there's an athlete reaching up for a rebound or something. You get to this point and they're having that pinching shoulder pain, and they're not going to want to go any further. They're in pain, they're not going further. So they will use everything else in their power to get up there. So reaching for that can of beans there, they're going to start shrugging their shoulder up. All this other musculature is going to start to go into spasm and develop scar tissue. You end up getting other problems as well as the tightness, but there's also a high correlation of numbness into the arms that go along with shoulder impingement for that reason. Treatment for shoulder impingement usually starts along the lines of over-the-counter pain medications. Then it goes into cortisone or steroidal injections into the bursa area right here, as well as physical therapy such as ultrasound, muscle stem stretching and strengthening of the rotator cuff muscles. And in really extreme cases, go into surgery. Now, looking at the surgery, let's try to understand why the surgery is performed. It's called an acromioplasty. If we're not looking at the tears, if it's for muscle tears, it's completely different. But a lot of times when you're considering a shoulder impingement, again, it's that pinching of the acromion onto the humerus, decreasing the space relatively. So there's 3 grades of acromions that you see in the normal population. Number 1 is it's a flat acromion. Number 2 would be more of a hooked, and this is probably number 2 on this model right here. Number 3 is where it's hooked a lot. Now chances are, if you have shoulder impingement and you have a grade 3 acromion slope, then you're going to they're going to recommend a surgery for you. And the surgery consists of, they're going to start shaving this acromion off just to create more space down here. But the only problem with this surgery is that this is a critical spot of attachment for some of the rotator cuff muscles, as well as the delt and the traps. So if those muscles aren't preserved with the surgery, then a lot of times there's secondary problems that follow after the surgery. Impingement syndrome can be treated very effectively with active release technique. ART is a very specific type of muscle work that will address all the soft tissue components of the shoulder that are extremely important when it comes to impingement syndrome. So think about what you have with the shoulder. Think about what you're gaining and what you're losing. What you gain by having a joint like the shoulder is that you have a ton of motion. Your range of motion is far beyond something like your elbow. Okay? Now what you lack is stability in the joint. And you just look at this model and it's not a correct representation of the joint. The labrum's not here, which forms more of a cup for this humeral head to sit in. But really, you have all this soft tissue, all this muscle holding this humeral head right in the joint. And if you don't have that, or if there's something messed up, like the tonicity of the muscle is not right, there's a lot of scar tissue in the muscle, it's going to cause biomechanical problems and cause the impingement syndrome. So before you do something severe, like getting cortisone injections or having surgery on it, please address the soft tissue components of the shoulder. It's in your best benefit, I promise you. So a lot of overhead athletes have impingement syndrome, such as baseball players, swimmers, even golfers get impingement, as well as desk workers. So it's very good at getting rid of scar tissue that has built up either from trauma or a muscle tear in the rotator cuff muscles, even overuse. It's very good at getting rid of that. So a lot of the patients that have it done to them for impingement, usually they come in about this high, and it's almost like a magic show at times. And I don't promise this on everybody, but a lot of times just the results are phenomenal. After the first treatment, a lot of times they're up here, their range of motion is way back, and that's the first step of correcting this condition. So active release technique is a very specific type of muscle work, like I said. It's considered as the gold standard of soft tissue care by many top athletes from different sports, such as the NFL, NHL, NBA. Mixed martial arts fighters use this a ton, as well as Olympic medalists use it as well. So a lot of times patients will report a significant decrease in their symptoms within 3 to 4 treatments. And that's not much, considering a lot of people go to physical therapy for 3 months, 3 times a week, and it's not much at all. So please, 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 if you're having chronic conditions in your shoulder or you're just tired of dealing with the pain, please check out an active release provider. You can find one. There's an ART list, a directory at www.activerelease.com. They should steer you in the right direction. Just type in your zip code and you should be fine from there. If you'd like more information on my type of treatment, active release technique in my area, or finding different information on different injuries and how ART can help, please visit my website at www.orangecountypainmanagement.com.